So think about this. The Medical Board is a regulatory agency that oversees the licensure of almost a dozen healthcare professions, totaling more than 103,000 licensees, and still growing. Many of those professions are familiar to the general public, but there are some that likely need a little more explanation. So take a deep breath with me, because in today's episode, we're learning all about respiratory therapists and the important work they do. You're listening to MedBoard Pulse, a podcast by the State Medical Board of Ohio. I'm your host, Jerica Kent, Chief of Communications. Let's talk Ohio. As always, we are so appreciative of those who tune in to learn about what we do at the Medical Board. And personally, I always enjoy doing episodes that feature one of our healthcare professions. I always learn something new, and I'm reminded of the importance of the board and making sure the right providers are in practice. Getting to today's topic, respiratory therapists are important medical professionals working in the field. And actually, they are a relatively new license type for the Medical Board. If we go back in time, we'll find that an independent respiratory care board was formed in 1989 with a pretty small staff. It wasn't until 2018 that the respiratory therapists were transferred to the jurisdiction of the Medical Board through House Bill 49. Over the years, respiratory therapists have grown in numbers, and there are hundreds of accredited programs across the country. At the end of fiscal year 25, we reported a total of 8,984 respiratory therapists licensed in the state of Ohio alone. This is a significant subset of our licensees, and we are regularly engaged in understanding what's needed to practice safely. We even present to respiratory care program students as part of our Partners in Professionalism program. We love doing that. Of course, the board has a responsibility to ensure qualified providers are licensed, appropriate rules and policies are implemented, and complaints are properly investigated. Per state law, the board has also appointed a Respiratory Care Advisory Council to provide advice to the board on policies and matters that impact the practice in Ohio. So this is a great time to introduce the guest for today's show, Matthew Monroe, a member of that council, a licensed respiratory therapist, a Marine, and so much more. Recently, we were able to hop on a call so he could explain to me the importance of respiratory therapy and how it impacts patients today. Take a listen to our conversation. Matt, thank you so very much for being here today and for jumping on this call with me. I really appreciate it.
It's my pleasure to be here.
First, of course, introduce yourself. Tell us about kind of your background and how you got here.
Okay. So Matt Monroe, as you said, Senior Administrator, Hospital Operations. So kind of a vague title, so to speak, but I have responsibility for clinical operations across the enterprise. So if you think of your areas, respiratory therapy departments, pulmonary procedural spaces, I have trauma and burn programs report up through me, administrative oversight for critical care. I have all the labs, imaging, bariatric surgeries, clinical engineering are responsibilities of mine clinically across the enterprise. My journey has been an interesting journey. I'm a respiratory therapist by training. Still keep all my licensing and credentialing.
I verify that.
Yeah, I started out in the field. I kind of joke. I've had two real jobs in my life. I was a Marine when I was young, and then when I was deciding whether I want to stay in or get out of the Marine Corps, my father had lung cancer at the time, was diagnosed, and so kind of chose to get out of the Marine Corps because I was deployed quite a bit, and that really introduced me to healthcare. And then watching my parents, my mom and dad, go through the experience of healthcare and how every touch point and every person along the way kind of either exacerbated their fears or alleviated their fears, kind of gave me the idea that maybe healthcare was a place that allowed me to kind of have that servant mentality, like I did in the Marine Corps. So chose to go back to school, use my GI money to get my degree in respiratory therapy. Then was at the bedside, enjoyed my time at the bedside, naturally moved into just leadership roles, kind of, charge roles, and then into clinical manager roles. Still at the bedside as a clinical manager, still in scrubs, still, taking assignments and being involved in day-to-day care. And then kind of progressed into a leadership role where I had multiple departments. They were respiratory departments at the time. And then from there, just became someone who just took on other areas of responsibility. And at this point, I've had a lot of different roles. Kind of prior to this role, I was regional director of operations for cancer services. And so I've kind of, at this point, I think I joke, I've had everything, responsibility for almost everything except for facilities within a hospital service or an ambulatory service at some point in my
Wow.
career.
Yeah, that I mean, that is quite the journey and the career that you've had. I imagine because today we're focusing specifically on the importance of respiratory therapy and what that role really looks like. I imagine some folks might not have heard of what a respiratory therapist is, and at least until the COVID-19 pandemic. Then all of a sudden, they were all over our commercials.
Yeah.
Can you tell me, like, what is the definition of respiratory therapy?
Yeah, so I think it's interesting. It was kind of funny. I was looked up the definition of respiratory therapy, and it's of course, it's a very it speaks of a field that of treatment and focus on helping individuals optimize their respiratory function. Evaluating, diagnosing, treating conditions that affect the lungs and breathing in general, with the goal of improving quality of life. Um, and it's interesting when I think about more in just as we talk through what it is to me or what I see is really that idea that you know when you look at the scope of respiratory therapy, it's really anything cardiopulmonary falls into the field of respiratory therapy. And so our respiratory therapist, at the other side, you are truly a bedside clinician who is improving the lives of those with any cardiopulmonary disease. Um, and has the ability to work with autonomy when needed, in any clinical setting and with any patient population.
Here's one thing that I've been wondering about. I have seen both the term respiratory therapist and I've seen respiratory care professional. Is there a preference in the terminology? Because I don't want to get it wrong.
Yeah, it's interesting. I don't know. I'm sure everyone would have their own personal opinion of this, right? And you see RCP used as a
Mhm.
credentialing respiratory care professional, but I would say, when you wander around a hospital or you talk to somebody, they would say, oh, I'm a respiratory therapist, or oh, that person's a respiratory therapist. So I think you see respiratory care professional used often in credentialing
Mm.
or on documentation, but in conversation, I would say most people would refer to themselves or to others as a respiratory therapist.
See, I told you we'd all learn something today. We're just scratching the surface, but we'll dive into more after our Medical Minute segment with Dr. O'Neill. Stay tuned.
Hi, Jerica. How are you today?
Oh, just lovely. So happy you're here in the studio with me, and we have an important topic to talk about coming into this new year. What are we talking about today?
Sure, let's spend a minute or two talking about alcohol in your health.
Ooh.
Jerica, did you know that about 180,000 people in the United States die from excessive alcohol use?
I had no idea.
And we really need to talk about what is a drink of alcohol. It may be less than most people think. So a drink of alcohol is considered 12 ounces of beer, 4 ounces of wine, or 1.5 ounces of hard liquor or 80 proof liquor. And, we talk about moderate alcohol use and we talk about excessive alcohol use. And excessive alcohol use is what we worry about. And that's when people do things like binge drink. And binge drinking is considered more than 4 drinks of alcohol in women or more than 5 drinks of alcohol in men.
In a day?
Not in a day, but in a single occasion or event, okay? And we talk about, heavy drinking. That's when a woman will drink 8 or more drinks of alcohol in a week, men 15. We're always concerned about underage drinking, and that's when people under the age of 21 are drinking alcohol. And we're also concerned about drinking while pregnant, because that puts the baby at risk for fecal alcohol spectrum disorder.
I see. So what are some other health risks associated with excessive drinking?
Sure. I mean, there are many. High blood pressure, heart disease, stroke, liver disease, multiple types of cancer, digestive problems, a weaker immune system. Alcohol can also contribute to obesity, memory problems, and mental health conditions.
I see. So basically, drinking too much can affect the way your stomach feels, the way your head feels, your memory. I'd rather, I think, eat my calories than drink them, but I also have a problem with sweets. Do you have any tips for people that want to responsibly drink?
Set yourself a drink limit and really stick to it. When you're going out with friends, avoid drinking rounds or playing those drinking games. Try to finish a drink before ordering another. Avoid people coming by and topping off your drink. Drinking water, before you go out, and intermix non-alcoholic drinks with alcoholic drinks. One really important thing I want everybody to remember is there is no safe level of alcohol when you're driving. So you really need to plan how you're going to get home before you go out. And that may be a designated driver, making sure that you're able to pay, for a ride share or a taxi, maybe public transportation, but really no drinking and driving. That's the most important thing. And, we want everyone to have fun, but we want to do it in moderation. Moderation is the key word.
These are excellent reminders, Dr. O'Neill. Thank you so much for hopping on with us today and making us better and making us healthier.
Thank you so much, Jerica.
Welcome back, listeners. In today's episode, we're featuring a recent conversation I had with Matthew Monroe, where he explains respiratory care from the perspective of a licensee and as a hospital administrator. Let's listen in. How can you distinguish a respiratory therapist in a clinical setting? How do you know that's who is coming into your room to treat you?
Yeah, so in today's world, we've done a lot of different things. Everywhere's badges with credentials. There are credentials on the badge, and we also usually have hangers on our badges that'll say, RRT for registered respiratory therapist, or RN for nurse, or PT, OT, physician, attending physician versus resident. We also, most hospitals have adopted colored scrubs, so that there's literature out there that says it's easier often for patients to just get used to understanding what color scrubs the team wears. When you think of where we find respiratory therapists, I know it's something we were thinking about talking about. Like, it's unique in the sense that we find respiratory therapists everywhere, right? If you enter the ED, you'll probably get the chance to see a respiratory therapist. If you come to us as a trauma, you're going to get to meet a respiratory therapist. If you're, when you think of birthing, like if you have a bad baby delivery or a high risk baby delivery, there's a respiratory therapist in the room. If they're, if you need, we are in where we have dive chambers, right? When you think of hyperbaric oxygen. We're obviously in all of your ICUs. You'll see us in pre and post spaces for surgical, in ambulatory settings. When we think of pulmonary disease, or you also see in rehab, cardiac and pulmonary rehab therapists working. So it's kind of a unique space.
Interesting. So yeah, you basically are all other both emergency situations, but also like inpatient and kind of regular routine things. Good to know. What kinds of tasks do they perform? Because they're an essential part of the healthcare teams.
Right. You have, the evaluating and treating of patients for, respiratory issues, anywhere from like asthma exacerbations to COPD patients. Then you'll also find therapists, for running all of your invasive ventilation. So any of your ventilated patients, the therapists are really, a lot of those decisions are protocol-driven decisions. When you think of ventilators, ventilators are extremely complex devices with many different modes of ventilation, depending on what's going on within the patient's lungs, or what the particular issue is, whether it's acute or chronic, and different pulmonary, whether you have pressure issues within the lungs or within the airways. Also, all of us breathe a little bit different. So when you're on a ventilator, being able to sync you to a ventilator is unique in and of itself. None of us really breathe the exact same way.
I didn't know that was a thing.
Inspired pressures or anything. Yes, we all have different. If you think of the way our airways are built, the way the flow that we use, to make us comfortable, are all different. So ventilators themselves allow us to tweak all those unique parameters to get you what we would call in sync with the ventilator, or comfortable on the ventilator. So therapists are always, you spend a lot of time with invasive ventilation in the kind of our sickest patients. We have a lot of non-invasive ventilation. When you think of CPAP and BiPAP, most people are probably familiar with it. If you haven't had the joy of being in the hospital, you're probably familiar with it. If you know somebody has sleep apnea. Once again, a lot of tweaking, as you can imagine. Not everyone, once again, everybody breathes a little bit different, has different needs, different comfort levels. So therapists will spend a lot of time. Um, Honestly, a lot of times when people are they spend a lot of time just with the mask fitting itself and finding there are a lot of different mask types, brands, shapes, sizes, and getting one that is comfortable, that not only fits you well, but is comfortable and you'll wear, because it doesn't do you any good if you're non-compliant. They also will spend a lot of time. Therapists spend a lot of time educating, the importance, why were you ordered on this? If you think of, CPAP, home CPAP for, people with obstructive sleep apnea, takes some getting used to. So a lot of education into the why behind it. And then in respiratory therapy, you find people that specialize. We have therapists who have, spend a lot of their time in a NICU, with the babies, or, you'll obviously in children's hospital, you have people who specialize in pediatrics. And so I think those are also unique settings. What's interesting at a hospital like Ohio State, we have therapists who have the specialized training in the NICU, but they also might be ED therapists. So on Monday, they might be in the NICU with the babies, and on Tuesday, their assignments in the ED with all the adult, patients. Or they might be in the Ross Hart Hospital and have specialized training in our cardiovascular space. Or, we obviously do transplants here too. We have therapists who have specialized knowledge and work with our lung transplants and our heart transplant patients also.
It also sounds like you probably have to kind of like people to be able to do it, because if there's a lot of education involved, it's going to be directly dealing with people or their caregivers or family members to make sure they understand. That's something I'll keep in mind.
Yeah, definitely have to like people. You're going to spend a lot of time talking to people. Honestly, when when you think of healthcare, we think of it as a team sport. So I guess you could say, if you're working with ventilated patients, maybe you don't have to talk to the patient all the time, but either their family members, or you're talking with the nurses, you're talking with the physicians, you're talking with PTOT, all
Mhm.
these different groups of people who are involved in that care.
What education is needed then if someone does want to take this career path?
Yeah, respiratory therapy is one of the fields where you can get into, with either a 2-year degree, a 4-year degree, and there's master's level programs. So the minimum is a 2-year degree in associates of science, and then there's a bachelor's prepared, a bachelor level trained, and then we have master's programs, both kind of a master's in science and also a new emerging field, the advanced practice respiratory therapist.
Course-wise work, I guess, is it that it's, a lot of science classes specifically, are they tailored towards respiratory therapy? Are there clinical, like,
Oh
rotations?
yeah.
How does that work?
Yeah, so it's cardiopulmonary. So when you think of, you're going to have anatomy and physiology, and your all your kind of science classes, and then it's heavy on the anatomy and physiology of the cardiopulmonary system. So you're going to spend a lot of time learning how the lungs and heart function together throughout the body, and the details of that. And then there's a heavy clinical um, presence. So depending on the program, if it's a 2-year program, you're typically get into clinicals right away. And in our managing time between clinicals and didactic classroom time. With your 4-year programs, typically your first year to 2 years is heavy on didactic, with your third and fourth year being very heavy on clinical rotations.
Yes, yeah. I know we do some presentations with Sinclair College. We go because one of the members of the council that you're also on is an instructor there, and so we've gone a few years now and talked to students while they're still there and they have a limited permit, and it's been really interesting to hear from the students who were like on the cusp of being in the profession, but are still got one toe in school. How did you enter the field? Again, you talked about kind of a winding path, but what really got you to jump into specifically that instead of nursing or being a PA or doctor?
Yeah, I kind of touched on it a little bit earlier. My father was diagnosed with lung cancer, so he spent a lot of time interacting with, in that cardiopulmonary space. Since he had lung cancer, he had to have a lobectomy. Spent, coming out of surgery, post-surgery, time on a ventilator. Did a lot of pulmonary rehab and things of that nature. So that was kind of what introduced me to the field. Was that, and then, for me, it was really, I like the idea of, for me, I wanted to be in critical care. I wanted to do trauma. Respiratory therapists, we do innovations, we do A lines, things of that nature. So it was a good fit for me. When you think of nursing, nursing is typically, there's lots of opportunities coming out of nursing school, but then typically once you get into a field, you kind of stay. If you're like a women and infants nurse, that's, kind of where you live, and you don't want to know anything about the ED, and you don't know anything about the right type of thing. So we're in respiratory, for me, like I liked, that I literally could be in the ED, I could be in the trauma bay, I could go to surgery, I could go up to the bad baby delivery and put, babies on ventilators and work at the NICU too. So I kind of liked having the freedom to work in many different spaces.
Awesome. I love hearing people's stories and how their paths bring them to the healthcare field. We'll hear more from Matt after a brief break.
Every month, the State Medical Board of Ohio meets to deliberate on potential disciplinary and policy matters. If you aren't able to attend a meeting or watch online, there is another way to stay informed. In the weeks following the meeting, the board publishes a monthly formal action list that includes the names of the discipline providers, a summary of the disciplinary actions initiated, and the sanctions imposed by the board during the meeting. To view this list and explore more resources, visit med.ohio.gov.
You're listening to MedBoard Pulse, and today we're talking about the importance of respiratory therapists in healthcare. Let's pick up where we left off in our conversation with Matt Monroe. Matt, you are a current member of the board's Respiratory Care Advisory Council, which is a statutory requirement for the board, and it allows us to hear then from licensed respiratory therapists and understand the needs they have and practice. What does your participation on the council entail?
Yeah, so we meet on a quarterly basis. The meetings, until I think our very last meeting, were always in person, but I believe some legislation was passed to allow us to do remote meetings. So had our last one virtually, but we would meet in person. We would receive updates, anything from the medical board, any pending rules changes or legislation that pertain to our field or kind of medicine in general. The OSRC, which is the Ohio State Respiratory Care, which is our professional organization at state level, they send a representative and kind of talk through things that's going on at both the national and state level professionally, anything that they think the board should be aware of or asking for support or just for awareness. So we always kind of review that. What I like about it is it's allowing, as the medical board, years ago, Respiratory Care had its own board. It was a separate board. And when we were rolled under the state medical board, I think, for me, it was funny at the time. A lot of people were nervous about it. I thought it was a good thing. I thought, at the end of the day, when you're a healthcare professional, obviously the medical board, the state medical board, and when you think of medicine, it is hierarchical in the sense that the physicians are the ones making orders and that are ultimately responsible for the patient care at the end of the day. So to me, having our profession under the medical board was a positive for our profession. The advisory panel, I think, allows, because the medical board is made up of physicians, it allows, and I like the fact that the medical board is interested in getting the thoughts from practicing, therapists across the state. So I think the big, it allows us to hear what's going on at the medical board, and for the medical board to hear what is going on within our profession and throughout the state, and where it's important that we get support from the medical board, and where there are concerns either in current state or future state, and how we're hoping they can help us.
The interaction then between the physician and the RCP, is it like an order that a physician's giving that kind of drives the work of the RCP? Is there a prescription, like even for like the equipment that's needed or that kind of thing, or how does that interaction work?
Yeah, so there's a lot of different ways when you think of it really depends on the setting. So let's see. When you think of medication, there's an order given for medication. There's always an order for medication. When you think of there's prescriptions written for home when respiratory therapists also work in home care when people are going on home on oxygen or going
That's a
home,
good point.
when they have trachs and they need trach care, or we have people live at home on ventilators. So there's therapists out there. That equipment requires a prescription, so that if you're going home and you need a home ventilator, the physician has to write for a home ventilator and the type of ventilator and the why, and so those would order. Within the hospital, we use a lot of protocol-driven therapies. So so ventilators are an example. The physician might write, for a trauma patient, a patient to be placed on ventilator, settings to be per protocol, and then there are very robust protocols that kind of allow the therapist to make decisions within their scope under kind of approved protocols and guidelines.
I appreciate that explanation. I read recently on the U.S. Bureau of Labor Statistics website that respiratory therapists are projected to increase 12% between 2024 and 2034. And the crazy thing to me is that that's not going to be that long. Like, it seems like a long way off, but I realize it's less than 10 years away. In your current role, do you see an increased need for therapists like what's predicted?
I think what's interesting is if you looked on a different website, you would have seen that I think most of the projections say there's about they're projecting anywhere from 22 to 28% shortage of respiratory therapists in the United States over the next 10 years too. So like all professions, we have an aging workforce, the days of people having 4 or 5 kids is kind of behind us. And so we don't have as many people coming into the workforce as we once did. And so we have an aging workforce with lots of people ready to retire and not as many therapists in the pipeline, so to speak, to replace them. So I think, as somebody who has oversight for, a large department, I think 2 things. There's a growth. I mean, there's a need for more therapists if we could find them. But the job market itself is it's a great time to be a respiratory therapist. Everyone needs a respiratory therapist. I think not too long ago in Central Ohio, we counted up that there was about 200 open job positions in Central Ohio with the 4 healthcare systems we have in Central Ohio. And if you think about it for context, here in Central Ohio, we have, I would guess 3 to 4 schools, you would say. Each school typically graduates a class of about 15 respiratory therapists. So this year we'll probably have 50 to 65 respiratory therapists graduate in Central Ohio, and we need about 200. Yes, it's very challenging.
Oh my goodness. I'm guessing there aren't like dual programs either. Like, you can be an RT and a nurse at the same time, and no.
Yeah, none of that.
Oh man. Tell me then, I feel like, because all of this leads to my next question, really, why is it an important profession? I mean, outside of literally giving us the air to breathe, what would you say is one of the most important reasons why it exists as a specialty and it's not just, absorbed into another role?
Yeah, I think, like they call it the ABCs, right? Airway, breathing and circulation. And so respiratory therapists are cardiopulmonary, so they hit all the important areas, right, of life saving. And there's really, we always there's a truth to the fact that if you have an untreated respiratory event, it will become a cardiac event eventually. The ability of people to specialize and work autonomously at a high level and provide care and education is important to for patient access and for patient safety, right, at the end of the day. So I think having these professions allows people to receive specialized care from a highly trained, highly educated person who can focus on their needs, and then it allows a critical care doctor to move on to the next sicker patient, right? Or to evaluate the next patient. It allows the pulmonologist to have that first initial consult with the next patient who's been waiting for weeks or months to get in for their first appointment because they're having difficulty breathing or having quality of life issues. So I think having robust specialized fields, it just allows for better access and better care.
Do you think being a clinician makes you a better administrator?
I do. I always kind of joke with people that, often when I'm in a room in a senior level meeting, short of the chief medical officer and the chief nursing officer, nobody else in the room is a clinician. And so I think it allows you to see that perspective, having the lens of both, providing the care, but understanding the business gives you a different perspective. Then I also say with my team, since I lead clinical teams, I kind of joke that it gives me a little bit of street cred because when I go into a department as the business leader, I don't have the first inclination of any clinician is to say that people in suits just don't understand because they've never taken care of anyone.
That is helpful.
And so they can't tell me that. They can't say I spent 8 years working in critical care and trauma. So I speak the language. I understand patient care. I can jump in and help if they need to transport a ventilator. I can jump in and help if I want to. I keep all my credentials active. I'm comfortable in a clinical setting. My current job is, I like the idea of the concept of, I always say, the larger span of control you have. They talk about leaders cast a shadow. When I work clinically, there was codes every day. That person that's watching their family member code has never seen someone code and potentially pass away, right? So I think, being a leader allows you to really focus on working with your teams to really say every patient every time matters, and every touch point matters, because it is unique for those people, and that experience matters to them, and they come to us in their time of need. They literally give us their family members, and they trust us to take care of them. Go back to being a respiratory therapist. Every day I felt like I made a difference in somebody's life. Every day I got to talk with a family member. I got to be involved in a code that came out well. I got to extubate a patient off a ventilator, that had been on a vent for 30 days, and now they could talk with their family members for the first time, and they were getting ready to move out of the ICU into a better place. So that was really, really important to me. And it was very enjoyable. My wife asks me to this day every day, "Do you miss when you got to wear pajamas to work?" And I'm like, "I do miss when I got to wear pajamas to work." That was what she called my scrubs, was pajamas. But yes, there's great satisfaction in making other people's days a little bit better.
Yeah. What advice would you give to someone who was thinking about choosing respiratory care as a profession?
Yeah, I think that the same advice I give all young people. I think that I would say, make sure that it's something you're really passionate about. We spend a lot of hours at work. I think you need to be passionate about the things you do. Doesn't mean that when you're at your work, there'll never be something that you're like, I wish they did this different, or I wish this was different. Of a friend who's actually a physician who would joke, if everything was perfect, that would be called volunteer work, and we wouldn't have to pay you to come. But in general, you do spend a lot of time at your job. If you want to be good at it, you're going to have to be passionate about what you do, and like it and believe in it. So I think, understanding the why behind what you're doing, and then embracing it once you're in it. I think I learned this when I was in the Marine Corps. People would go in the Marine Corps and they get in, they're like, "I can't believe I signed up for this. This is miserable." I'm like, "Well, you're here. You can either make yourself miserable for 4 years, or you can make the most of it and do really great things for 4 years." And I think it's the same. I think when you do something, do it well. If it turns out it's not what you really thought it was going to be, while you're there, do a really great job and go find where your path is supposed to be.
Thank you for spending the time with me today on this call. I really appreciate it. I know you're a busy man. I think you probably make a lasting mark on anyone's life who you are interacting with, whether it was through some clinical, you jump in, to be all hands on deck, or whether it's through the way that you're thinking about healthcare as an administrator. So thank you so very much today.
Thank you. It's my pleasure.
I can't think of many things more essential to life than breathing. It's comforting to me to know that there are healthcare professionals who study and focus on complications that impact the respiratory process. Even though we have not had jurisdiction over respiratory therapists for very long, they play an incredibly important role in healthcare. You may have even experienced them yourself, taking care of you or one of your loved ones. If that's the case, or you know someone who is a licensed respiratory therapist, make sure to thank them for all that they do. Thank you for listening to this episode of MedBoard Pulse from the State Medical Board. I'm especially grateful to our special guest, Matthew Monroe, for speaking with us about respiratory care and the importance of it in patient care. Subscribe today to hear our episodes right away. For more information about the Medical Board, visit med.ohio.gov. You can also email questions or comments to communications@med.ohio.gov. And remember, the more you listen, the more you'll learn, the more you'll share.